Yeah, I didn't know. Huge. Look.
And believe it or not, we're live. So here we are sitting in a hotel room right out at the outskirts of the Association for Healthcare and Philanthropy conference. And so for those of you who are with us live, we really appreciate your hanging out with us. We know some of you are in the air right now, as you were, Bill, just a few minutes ago, and Betsy was not long before. So if you're enjoying this later, I hope that you'll feel free to engage with these folks. We'll make sure you have the contact information at the conclusion of the conversation today. This is, of course, the Philanthropy Mastermind series brought to you by our friends at DonorSearch, no less. Bill and the team at DonorSearch have been making it possible for us to have conversations like this one since 2016. So this is, I think, episode 610 or something like that.
Is it really?
It's something along those lines. I keep losing track, but we're doing a lot. And we've had the pleasure of having both of these fine folks in the series before in different ways. Betsy, of course, in addition to being CEO of the Cordon, you are the Cy Seymour recipient with AHP. You're an FAHP, which is the highest designation in the field. And you were kind enough not only to have conversations with us a couple of times, but in the podcast. So we're really grateful for that.
Thank you. Love being part of this. I said earlier, two of my favorite humans.
And the other favorite human here, of course, is Bill Tedesco, the CEO and founder of DonorSearch. And I know we've talked about DonorSearch before, but I'm sure we'll touch on some of the data that DonorSearch has in the course of the conversation today about the state of healthcare philanthropy. I'm not going to be able to see who all is with us today. That will be monitored by Jack, our producer, but we will have a little eye open for anything that goes on in the chat. So I hope that you will let us know that you're here. That's really helpful to the other people who are in the room with you so they can converse with you, but also a way for us to know who's present, maybe which part of the country you're from or the world, and maybe what you do or where you work. All of that would be really helpful information. We also really want to encourage you to be a part of the conversation. So if you have a question or a comment, those will all be relayed to me by Jack during the course of the conversation today. So enough of the preamble. Why are we here and what's it all about? And we don't have much time to talk about it, but there's two big things. And this was inspired, I know, by the Giving Pulse report. So first of all, do you mind if I ask you to just say what that is and why it's important?
You can. And then I'll fill in the blanks or I'll run with it.
What do you feel? You're the man who really did the work.
Research?
Yeah.
I had shared with Betsy and Jay that knowing that I was going to be sitting down like this and knowing how much I enjoy hearing Betsy talk, I wanted to make sure that I was warranted the place on the couch here. Yeah, I think the initial thing we're reacting to is the Nonprofit Times did an article on the Giving Pulse, which I think is a department inside of Giving Tuesday. They have a research program. Giving Pulse I think is the research program, and it's after doing the research, I thought it was pretty interesting. What they do is every week, if I get this wrong, feel free to reach out to me and tell me as such. But every week, they interview 100 people, and they survey them. I think I saw someplace where they actually talk to them, which would be ambitious, at the very least, the survey. And if you think about that in terms of a quarterly time frame, that means there's 1,200 individual that have offered their opinion and answered the questions that were involved there. And best I can tell is they've been doing this for at least 2 years, because they have data that goes all the way back to 2023. And they ask questions about, they put it under the major head of generosity. And of course, giving is one of those categories, but then they put volunteerism, and then they put advocacy in there as well. So it took me a little while to kind of parse that out, because I was, jumping in, trying to figure out what the giving numbers are. So they don't reveal any giving numbers, but they, in the conversations that they've had with these 1,200 different people, that's how they do the research. I mean, there's a lot more to it, and it appears as though they're adding layers to it on a regular basis. So the 6.9% decline was a function of the full quarter, the 1,200 people that were interviewed, they were being asked very direct questions. I was actually very surprised. Questions such as, have you been solicited in the past
Right.
month?
Right.
I can say more, but I can stop talking too.
Well, that's really key, I guess, is that relationship between whether or not people are not just being cultivated and aware and they're donors or not, but whether or not they've actually been asked for support. And this is something that not many surveys seem to look at both sides, of the giving economy, if you will. So that's quite important. The one stat that I took away and I have written down so I won't forget is that year-to-date low in solicitation as the time of that report, which I think goes back to September, and it was down 12%. So the giving was down for almost 7%, as you said, but solicitation was down by 12%. That seems to be the whole story right there, but maybe it's not. So Betsy, what's your reaction to all this?
Yeah, I mean, it goes back to in some part the old quote of we miss all the shots we don't take. And I think that we have been reticent sometimes to step forward and we'll say, oh, well, it's an election year. People are tied up to doing other things. We shouldn't ask. The economy is struggling. It's not a good time. We shouldn't ask. And so sometimes I think we create artificial constraints for our own work by just deciding that it's not the right time to get out and engage with people. And yet I would imagine any person who participated in that survey, they're accustomed to being asked, they're accustomed to being engaged. And so our treating them as being fragile and being careful with them was probably not of value to them. They probably had an expectation that they would be engaged and they just simply were not.
Right. In fact, this is something that I'd love to ask the folks who are here with us, and maybe they're answering you right now.
There they are.
You're anticipating us. Thank you. Which is whether or not in your organizations you held back this year. So what are the reasons that people might have held back? Why? I mean, was it mainly politics or was it something else? I mean,
Why
we
the
were getting hit
development
by our
officers held
phones sometimes. Yeah, why?
So again, digging further into the study, they said that while the asks were down, and the asks were down across all the different verticals of nonprofit.
So not just healthcare, right?
Not just healthcare, right? The people who said, yeah, I'm interested based on the ask that I got, that percentage stayed the same. So basically, if I use a salesperson's analogy, is they're talking to fewer qualified people and they're getting the same sort of success rate where people are interested in what you have to say. I think it's something that comes due in a big way later, a bigger way. Part of the rationale, and because I thought it might be because of the political campaign, I mean, they dropped in $15 billion. $15 billion for this cycle. And excuse me, 16 billion, because the last cycle in 2020 was 15. And this one exceeded it by $1 billion. And the PACs alone did 5 billion by themselves. Wow. And there's a whole host of reasons that the people who make large gifts charitably could imagine that sort of disposable income needs to be assigned to this other priority, the political priority, because it's a little more, well, it's urgent, isn't it? Yeah.
That's something you've been studying for a long time. It's this relationship between
not just today.
Political giving and philanthropic giving, and it's not zero sum, right? I mean, it's the right direction. So if people give politically, it doesn't mean they won't give philanthropically, but I think sometimes people have that impression.
Yes, yeah, because we do think that it's about scarcity, not about abundance.
Right.
And so it's an easy narrative to embrace, to say, oh, we can't because they're not going to be in a position to. However, I do like that with fewer solicitations, people are still getting the same degree of effectiveness. And so, maybe that also says something about we're doing a better job curating those we ask. That it is about quality and that we're getting more insightful and more thoughtful, because if we're getting equal returns with less solicitations, that means maybe we're just also doing our work better than we have before. And, certainly with integration of tools like artificial intelligence, we are gaining insights into our donors and their expectations and their desires for impact that we didn't have before. And so maybe it's also something that's just moving alongside with the availability of information that didn't exist even a year ago.
One of the things that I wanted to ask you both about, and it came through in the report that none of us have read yet fully, but at AHP is talking about, there's a new report from AHP. It's the 2024 report on giving from AHP, which I think anybody can get access to.
Yes.
So we'll make sure, perhaps Jack can include a link in the chat, and then we'll make sure we put that in the show notes. But there are a number of things, and the top one has to do with campaigns. So this is really what I wanted to ask you. It's sort of like the question that we all have about, well, if people are giving politically, do they have the bandwidth to give philanthropically? And sometimes we hold back when maybe we shouldn't. That seems to be one of the messages. But also, we are getting more efficient and smarter in fundraising. That's a good thing. We've also been putting a lot of emphasis on campaign work, on major donors, and we've been doing that for years, and simultaneously seen this kind of, convergence where as we focus more on the top end, we're seeing a decline in the overall percentage of people who give. So is there a relationship there? Is what we are doing having an unanticipated or what's the right word for it? This effect of actually suppressing giving overall, because we're focusing all this attention on a few.
So I'm going to go back to the study just because I had 5 hours on the plane to look at it. The decline, which I had to dig it out of the report, didn't just jump out at me. They actually measure whether or not the money or the solicitation is being made through what you would call registered nonprofits, i.e. 501c3s, right? Unregistered organizations or individuals. And the decline, most of the decline that they were talking about was in the unregistered organizations and in the individual giving. So it wasn't really clear to me what that would look like. I guess if that's when you're being called and asked, or you a generous person, if you help out your neighbor who's struggling or something like that, that would make sense. And as an unregistered organization, it could be like a community organization that, and they also measure whether or not you've given money, whether you've given your time, volunteer, advocacy, and then items. So anyway, how do I feel about it? I'm aware that the number of Americans that are charitable on the giving side of stuff is declining. I also, I've at least seen the reports about how nonprofits, the registered nonprofits, the trust that people have in them has actually fallen below the trust level they have for corporations, which is, if you think about that, maybe this is going back too far, but that really feels strange. I mean, wasn't that long ago where, what was it, 90% of the marketing that a for-profit does is ignored, and they'll take a recommendation from a complete stranger,
right?
And that will supersede the value of anything the corporation is doing. It just, anyway.
We have an issue with trust, certainly, in this whole, and I don't know whether or not that is being addressed. I mean, I don't know if that's in the Giving Pulse report at all, but whether, as we, let's say, hold back from asking people from support, whether it's at the top level or across the base of all of our supporters, whether that action of talking less often, of engaging less frequently, because we are trying to be protective of them, maybe ends up having this, again, this unpredicted effect of decreasing trust.
Absolutely. I think it's interesting. We've always created kind of arbitrary wait times in our relationships with donors too, that we think, oh, well, I took them to lunch this time, so I should wait for this respectful period of time before I reach out to them again. And meanwhile, if I went to, if I sat down with you today, I wouldn't feel weird at all about calling you and being like, hey, Jay, what are you doing tomorrow? Because we have a relationship and we have connective fiber. We care about each other. We have like something authentic.
Right.
And so I don't feel weird about calling you again tomorrow. I feel like, oh, was it too early to call Jay? Or that'd be a little bit creepy. But we do that with donors all the time and say, I talked to him last week, I shouldn't call him again. So I think like if we're going to lean into authentic relationships, we need to unburden ourselves of worrying about creating arbitrary wait times before we reach out to people again. Because I think part of building trust is building relationship equity, demonstrating that you follow through on your promises, letting people know you and see you. And so we got to think about that from a trust standpoint for philanthropy officers, but we also have got to be effective in working through our allies, that we know that we have folks who already have kind of objective earned trust, whether they are our physicians or our board members or others. And so we've got to think about how we engage those objective advocates who can say, I'm involved in the organization, they're doing great things. I will vouch for them with my own social capital to say that I believe that they are trustworthy, because donors are saying, I feel it's really important for me to trust an organization, yet I don't have trust. We now, as hospitals and as nonprofits, are behind corporations and the media for groups of people trust. And you think on one hand, really sad to me that people don't trust a hospital as much as they trust a corporate entity or the media. I think frankly the others are more likely to be scurrilous than we are.
And this comes from somebody who actually spent a little time in newsrooms.
Yeah,
So you know what you're talking about. It's funny because you started to channel what's, again, in this new report that none of us have really been able to look through. And one part is about campaigns, that they say that high performing campaigns leverage, of course, their board members really significantly. I mean, the top 25% of performers, if I read the stats right, have an 80% rate of board engagement in fundraising.
Yes.
So, but they also talk about the staff level, which you and I have discussed before, and I know you followed across the arc of your career, in that when we have volunteers and we give them a real role, a real relationship-based role, and something to do, that it raises, it increases the trust with our supporters, but it also increases the revenues that we bring in. So again, simple question with a hard answer, which is, you told us why you think that people maybe held back a little bit the second quarter of last year. Hopefully they're going to reverse that trend. Why do some organizations seem to be ready to engage with board members and others in this way, and staff, especially physicians?
Yes.
And why are other organizations so reticent to do it?
Yes. Okay, I'm going to answer your question, but I'm going to go two random directions in answering it. First, I think we have to ask ourselves in some part, what is a campaign? A campaign in some part was bringing a very clear focus on what is strategically important to an organization in order to provide transformative value. And it's something that is time bound, that has urgency, and we have real focus on getting it done. So a campaign, in my mind, is what everyday good fund development should look like. We should be in serial back-to-back campaigns instead of saying, oh, we had a campaign, let's wait 10 years before we have another one. So we talk at Accordion all the time about wave campaigns. You should always be cycling something up, and as it starts to cycle down, something else should cycle up. With that, in volunteers, one of the things that we see is we almost always get greater value, greater efficacy out of campaign cabinets than we do out of our board of directors. And I think that that's for some very specific reasons. With a campaign cabinet, they're asked to come and do something that is very clear, very specific, aligned with their purpose and their affinity, and they know what success looks like. And so in my mind, campaign volunteers are able to be very task-oriented and goal-oriented, to dig in and get the job done. Whereas boards are often kind of like getting in this organization, and we're kind of meandering in the woods on what they're supposed to do, how they're supposed to do it. They go to board meetings and they're low value, they're disengaging. They don't feel that it's something that is commensurate with the value of their time. And so I think we've got to think about campaigns both them from being very directed in what we're raising money for transformative projects, and think about engaging volunteers in different ways. One of the stats that I think is really interesting is the desire of people who are influential and affluent to volunteer has been declining. And that's because they say in part, I'm too busy and they want me to do low value work. And so if we could marry those concepts together and say, we are going to embrace a concept where we are always raising money for top level strategic time-bound priorities, and we are engaging community leadership volunteers who are affluent and influential in very task-oriented, goal-oriented, short-term projects to get the job done. Boom, that to me is where we get to really transformative fund development.
I wish I could repeat half of what you said, but the one part that really struck me, because I think so few people do it, is the idea that these volunteers are often asked to do low-level work. So they're busy, but when they're asked to do something, it's not something that doesn't really truly engage them or make use of their skills, their abilities, and what's in their head, which is really terrifying.
Absolutely. So my colleague Rebecca and I have been talking a lot recently about the fact that you recruit these really high-performing, exceptional leaders to be on a board, and then you have them sit there and do not a whole lot, and they have a lot of demands on their time, and they don't want to sign up for a 3-year board term where we're going to wander the woods without clarity to what we've been asked to do. And so if we could just rethink board engagement, that's something actually, if you're here at AHP, come see me Thursday. I'm talking about that in Express Talk on Thursday here at the AHP International Conference, because I think it's something we've got to get our hands around if we're going to use community leadership volunteers in a smarter, more effective way.
And by the way, the conference here, is this being recorded, the conference? Do you know?
No, it's not.
There are some virtual sessions.
No. Okay.
I thought I saw it on the homepage. I don't know if they're live or whether or not they're going to be recordings.
Because this is kind of a brain trust here, and we're lucky to have a preview of it with Bill and Betsy. But it's a good argument for why there's still a need, whether it's virtual or in person, to get together. If nothing else, not only to provide us the ammunition we need to make these arguments internally, to get people to make changes they need to make, but also because it revs up our own engines, so we can go back and get.
Absolutely.
You know, it's what you've described is kind of like the essence of, you know, when you look at these, when I look at these self-improvement things, about setting goals and pursuing them and trying to take advantage of your own biology to do that. And I can honestly say 10 years ago, I was not comfortable setting goals. And when I say not comfortable, I didn't do it very often. I didn't understand the process. So it's taken a fairly long time. There was a lot to unravel there. But it's the clarity now. I mean, if you don't give people a goal that they can accomplish, number one, they don't know when they're done. And then number two, there's a little charge that you get when you finish a goal. I mean, it's just biological. It's like you get endorphins and you're like all charged up to do another one. And when you were describing the boards, I was thinking way back when I used to be a development officer and I would torture my board of directors. And I'd have full control over that. I'll be honest. Again, it wasn't my goal, but I just would watch them squirm in their seats and try to slink down. And well, anyway, they didn't have phones at the time. So they just were all looking at the door, waiting to walk out the door. And I won't tolerate that now. I won't tolerate that with somebody that I work for. And it's just like, come on, you come in here, you have an objective, you know, give me a solution. If I've asked you to fix a problem or at least some ideas, or at the very least, we do some brainstorming, but don't just wander in here and say, no, I couldn't figure it out. What do you want to do? Yeah, I'd like you to leave, right? You know?
Well, and I think too, okay, so the vast majority of board members will say they detest the idea of fundraising. There have been multiple studies that have come out that said that fund development is their least favorite task. However, you know where that flips? It flips when we ask them to do something they're passionate about. So like you come to me and say, we're working on a project that is closely aligned with your own personal values, your personal interests, your personal experience. Will you help us champion this forward? It's very different than coming and saying, hey, we have some priorities of the health system that are important to us, and we want your help with them. Real difference in just like intrinsic motivation and alignment with how I want to like feel fulfilled as a human being based on whether I personally have affinity for the project or not. And it's a very different ask to ask me to be part of something I believe in, as opposed to something you just want me to do.
So how do we conduct the inventory so we start to properly match up the talents of the people in our orbit to the tasks which give them the most energy so they can complete them? I mean, especially whether it's the staff of your companies or whether it's the organizations you work with, that are your clients. How do we make sure that we've actually found out what they can do so we can have them do?
I can add a geek dimension to this. So with generative AI, we are in the process of releasing right now something that basically says it goes out and looks for more recent information that you typically find in an AI environment, and then kind of pulls it together into a quick summary, and then you get all the detail down below it. The next gen, hopefully, cross fingers, is as if you can give me your case for support, and it has 5, 6 different priorities in it, and then you match that back to their charitable giving through themselves or through their foundation, and or take a look at the company, see if there's a logical fit there. Oh, you know, that's just icing on top of the cake if that actually works, because then they have a business reason, they have a philanthropic reason to work with you. I think it'll work. I've tested it with some, you know, like underhand throws to it and stuff, knowing that the person had given to something. We'll see if it's going to work, but yeah, we're testing it.
It sounds like it's also something that could be a good internal tool, because sometimes, at least with organizations I've worked with, sometimes the board members themselves don't seem to have gone through anything that they recognize as an onboarding process, or to have a definition of what it is they're supposed to do, or especially if there's a big goal coming up, to give them tasks that are tailored to their interests.
Right. Have you done endowments? Have you done buildings? What type of buildings have you worked with? Or you cool with doing operating budgets for this type of program, whether it be, you know, liberal arts or something else. And I don't expect all 5 of those to ever match for any one individual, you know, if there were, let's say, 5 of those sort of priorities. But my goodness, if you get 1 or 2, I mean, you're way ahead of the game. And this is the plan. If you can, if you can do it at scale.
Right.
Can you do it with 500?
Yes.
As the consultant to XYZ nonprofit, can I give you a short list and say, oh, laugh it off, it's AI, all that sort of stuff.
Yes.
But how do you feel about those 2 or 3 different things that it
Yeah.
suggested that you've already been involved with? So that's one way. I think we can kind of get there. I don't think it really provides enough. There's a comparable thing like with employees. Back when you were in the office, you got to know folks, you know, as much as they wanted to tell you anyhow. And that becomes important to understanding what they want professionally. With that disconnect now, you know, everybody being remote, that's a lot harder to do. And anyway.
So, you know, I have so many things I could just rant on related to what we just talked about. So I'm gonna push on 2 of them. One, I love that you said, you know, board members come on and they are not well oriented. I have the incredible privilege and joy of doing board retreats all over the country, and I love doing that work. But what I often find out from chief philanthropy officers is they say, we need to train them up because they're kind of the wrong people. They don't know what to do. They're not sure how to be helpful. Well, training people up who are the wrong people could have been solved in some part by better selection on the front end. And while Bill has the, you know, sexy techie scaled AI way of figuring out people's spending, I'm giving you sexy. I'm giving you sexy techie scale. You know, years ago, I started saying to chief philanthropy officers, you need to go sit down with someone knee to knee in their living room and ask them simple questions about what they believe in and care about. And people would say, oh, I don't have time to do that. Like, do you realize I have 25 board members? I don't have time to go sit down with all of them individually. And I said, just for kicks, Goes to pocket. And people would come back all the time and say, I can't believe what happened. I understand that person in a way that I didn't before. And so why don't we do that at the very front end before someone's even selected to come on our board, to go and sit down and say, what do you believe in? What do you care about? What dent do you want to make in the universe? Why do you want to be part of our organization? How could you see yourself adding value? We have this big project and we need to be connected to these people. Do you know these people? Could you introduce us to them? Like, if we had some better selection conversations on the front end, we would be much more capable of selecting the right people and asking them to do the right things. And it's so basic, yet it often does not occur.
No, in fact, it's funny, I've seen lots of different approaches to board recruitment that are essentially just an Excel spreadsheet where they're filling out, to see which person fits which pigeonhole,
Yes.
rather than doing this inventory of questions. So it's important to know capacity and whether or not they've given before, but there's something else that you can deduce both from data, but also just asking some questions. And that merger of information can be really powerful, I guess.
Absolutely. And if you have one of those sheets that is a board recruitment grid that says something on the left-hand side, like lawyer, accountant, marketing executive, I have a way that you can improve that immediately. Take it, stand over the shredder, and feed it slowly into the shredder until it disappears.
So we won't be sharing that grid with you today because it's been shredded. Yes.
Yeah, because it's garbage. It's not looking for the right things to bring people around our table. We need to think about their characteristics, their competencies, their commitments, their connections. We need to think about people in a much more holistic way than what job title do you hold, because we are not tiny nonprofits where our board members are de facto our management team. We're much more sophisticated than that. We don't need somebody to do our accounting work. We generally in a hospital have a whole accounting department. So we don't need that. So we need to be selecting people based on the work to be done, not just a bunch of arbitrary characteristics. So feed it slowly. Much good.
And if it's digital, you can do the equivalent.
You delete it.
Called the delete button.
Yes.
Not as slow.
It's fine. It is.
It's funny because we started this conversation talking about how people aren't asking for money because they're afraid. Now we're talking about how people aren't asking some of these questions during maybe one of the most important parts, which is bringing people on, not only who can help us generate revenue, but have the legal and fiduciary responsibility of our organizations as a public good, which sounds a little fancy, but it really is meaningful because it's, as you say, regardless of the size of our organizations, they're always bigger than we think they are when we're sitting in a role where we're just trying to raise some money. That's very important, but imagine what we leverage by doing all these different tasks.
Yes.
So going back to the very beginning of this, and we're thinking about whether or not the numbers are up or down, and clearly, at least in that quarter, they were down. A couple impossible questions. First, do you see that reversing? Do you see anything that's reversing that trend? And two, are there any specifics besides some of the things that you mentioned already that you think people should be planning to do as they enter the new year that would enable them in terms of their staffing, their planning, their engagement, that will help them to be more confident to go out there and engage with people in a way that's bringing in more revenue to serve more people in healthcare?
Yes.
I would say that if you lean in on the idea that political giving was crowding out charitable giving, I could be naive, but I don't see a lot of short-term needs for that sort of political support. And I found there's a University of Indiana Lilly study that says that there is a trend, there's a correlation between reduced charitable giving and the increase in political giving. How do I say this tactfully? One of the other reasons that the giving changes is because people are concerned about the risk financially. There could be different policies and all that sort of stuff. And I would say certainly on the major donor side, look at me trying to walk the tightrope here. I don't think there's any there. I think there's a lot less concern right now. I'm not saying I agree with it, but I mean, you can look at some of the stuff that's just happened in the past, what, 5, 6, 10 hours. And there's going to, that one of the other reasons is the risk is that people were concerned about, you know, the value of their portfolios and all that sort of stuff. And
the market's way up today for those who are not paying
Yeah.
attention.
Watching market.
yeah, I think that a lot of folks at the upper end are going to do very well. I think the sort of, you know, what do they call that, where the money all kind of clusters in one place, where it's not gravitation. At any rate, I think that's probably going to increase.
I know what I call it. I call it envy, because that's what I have.
We'll go with that. That's positive. That's very positive. I think if anything, you'll probably see that more of your giving is going to come from even fewer people. And it was a hard thing to believe back when it was 80-20. Oh, no way, that's going to happen. Then it got to 85. And you say, oh, it's all done now, right? Then it's 90. And then it's, in a lot of places, it's 95% now.
It is.
I think that sort of, that's the word I was looking for. That sort of concentration of wealth is going to become even more extreme. So you know, I suspect there will be a fairly heavy demand for our services for trying to isolate that, you know, 3, 4, 5, at max 10%, at least from the wealth perspective. And I just think that's going to become a little bit more extreme. If you can imagine it being.
And Betsy, I know you have thoughts on this too, especially when it comes to, again, our whole healthcare environment. And we don't know what the political ramifications of the election are yet, but we do know that there's a lot of need among hospitals. The margins, you've talked about this before, the margins can be very small. And so the need for philanthropy is very great. If anything, it's greater maybe now after the election than before. So
So so I have a lot of divergent thoughts once again. So last year, if you watch the Kaufman Hall Financial Pulse Report for healthcare, we ended at a 1.2% median operating margin for hospitals across the board. Terrible. And Moody's Investor Service says we need at least 5% just to stand still, replace our base equipment. We've actually had a pretty good year for healthcare operating margins after 3 of the worst financial years in history. So this year, median operating margins are actually tracking close to 4%, which is like, amazing for all of us. So it's looking better. However, still not enough to drive all the work that needs to be done. Healthcare is in a period of transformation. There are expectations for us to work alongside things like personalized medicine, rising commitments to community and other things. So still a lot of demand. So now I'm going to go kind of backwards and go back to campaigns. I'm going to say this a little bit on Thursday in opening remarks at AHP too. People come to me all the time and say, how do we raise more money? And in my mind, you can have all the right talent, all the right programs, all the right data. If you do not have a cogent and compelling story of transformation to tell, you can forget it. Nothing else matters. And what a lot of organizations really struggle around is identifying what does their system aspire to do? How can they affect change? Why can they be trusted to do it? And so I think if we're going to really accelerate fund development, it's got to start with strategic alignment, figuring out what we're going to do, how we're going to position it and get it out there. I also go to this whole 95% of the money coming 5% of the donors, which the data is all saying that is our new reality. The money is coming from fewer and fewer hands.
And this is campaign and non-campaign.
This is campaign and non-campaign. So, what I say to people all the time now is we used to talk about building the big tent. The big tent is gone. We are talking about building the small table. So who are your 5%? And where I think people get kind of wrapped around the axle around that is we're not asking you who the 5% of people are in your community who have the most money. It's not about the 5% wealthiest. It's about the people who are in your tribe. And people who are in your tribe not only have the financial wherewithal to be able to participate, but also have deep affinity for your cause,
Right.
have real and trusted connections to your organization. And so you've got to figure out who has all of those things. And we know that one of the things that becomes incredibly important is, did they have experience? Because if they had an experience in your healthcare organization, they are far more likely to both understand and care about your mission and action than anybody else. So if we figure out who is in our tribe, it comes down to me to the acronym CARE: connections, affinity, resources, experience. Because we need to know who our 5% are, and we need to make sure they're in our portfolios. We are proactively building those relationships, and we know why they're here and what they want to do.
In the Giving Pulse, they tried to divide up constituents, donors, into 3 categories. And I think at the low category, they called them low activity. I think it was a very generous term. And then they had active, and then they had something at the top. I can't remember exactly what the phrase was, but they were trying to build the profiles of who those folks were. And if you go all the way back to the beginning of the conversation, you know, what generous things have you done in the past week? I.e., have you volunteered? Have you been an advocate? Have you given something away? They've already come to the conclusion, I might add, somewhat predictably, that sort of level of engagement starts to demonstrate that those characteristics that you're after. And you know, I'll just say AI is just math, folks. That's all it really is. It's just much faster computers doing a lot more math. But with that oversimplification, custom modeling is doing just that. It's looking at those variables at the same time you're looking at, you know, how many times they gave in the last quarter, how many times they give in the last year, how much they all those different variables. That's when you start to use AI to predict who are the next best people to, in our case anyhow, people to solicit. It applies directly to what you do when you're trying to recruit your board members, because you want people that are engaged, because that's where the emotion starts to kick up, and you know, they feel good about it, right?
Yes,
Yeah,
absolutely. Absolutely.
We've made several kind of side references to AI, and there's a big session on AI at this conference. And I have a feeling that may not be recorded, unfortunately. But I know that this is something that both of you work on quite a bit. I want to dig into that, but I first want to prompt the audience. If there's anyone who's with us live and has a question, now is the time for it. So go ahead and post that. Jack will share that with me. So again, this is a chance to talk directly with Betsy and with Bill on these issues that are so important for us, whether it's the tools that are going to help you to do what you do, or the arguments that are going to enable you to persuade others within your organizational leadership to do what they need to do. So go ahead and ask those questions now. We'll make sure to build those in. And while you're doing that, I want to ask each of you, if you wouldn't mind, just to share how people can learn more about each of you and maybe follow your work. Bill, do you want to start there?
Sure. We have a whole website,
But I don't want to
we have
assume
about 100
anything.
people that can kind of give you an idea. I'm joking with you. Jay and I have known each other for at least 25 years. Yeah, it's that's kind of like the beginning and the end of what I do professionally, just to be quick.
So DonorSearch.net, and you can learn all you need to know. Not really, but there's
probably a lot more than you need to know. Probably a lot more. So
it's not like you're a big poster on LinkedIn or anything. So I think people have to be satisfied with that. But they will see you around in conferences and doing things like that from time to time, like here. So be on the lookout. And
thanks for asking.
Yeah.
And Betsy.
accordinghealth.com, and please do go find me on LinkedIn. I've not been as active as I should be recently, but I love the community and the conversation there. And I really appreciate when people not only say I'm reading your posts and I'm getting value, but I love when people push back and say, hey, have you thought about this? Or let me connect you to this. So please, find me on LinkedIn, Betsy Chapin Taylor, and let's create conversation and community.
Thank you. And we'll make sure that we put all those, Jack, if you will, in the chat so people can just click that link and check out both those sites. Maybe as a kind of a final question then, as we get towards the end here and both of you run off to your next meetings because they're about to come up. is what do you hope to take away from this, especially in light of this movement towards AI being in everything? I mean, we used to talk about the Internet of Things. Do you remember this a long time ago?
It's the same conversation.
It is kind of the same conversation, except now it really is. I mean, your toaster talking to you. I mean, almost. That everything is enabled, but that doesn't mean it's always enabling us to do the best work. So what is it that you're looking forward to, both from this meeting here, but also more generally as we get into this next year and we think about how we're going to move those margins so they don't go from 1.2% to 4% once in a while, but we really start to provide the care that our communities need, because the government isn't going to do it necessarily.
AI is a cultural discussion that's going on right now. Okay. And it's easy. It's only 2 letters, right? Everybody can spell it. And the truth of the matter is that it's a product of some really incredible technological sort of advancements that really only happened in the past year or 2. But talking about AI and talking about fundraising is like talking about, I used this kind of calculator to do the math that got me to this formula. It's just a mechanical tool that can do more than most of the mechanical tools that you've been familiar with. Personally, as perspective, we're in the process of trying to roll out AI embedded in everything that we do, with our email, with our document storage, inside of our kind of like standard applications. And we're going to have some little contest and ask people what's the most innovative thing that they've done. I think from a professional development perspective for the staff, if they haven't embraced it, they need to embrace it, because it's just going to be the difference between the person, and you might remember this, maybe you remember this, but it's the people who are willing to use the computer to do the spreadsheet or to do the Word document, and those that weren't. It's the same battle. You got folks who are going to resist technology for as long as they can till it costs them their job. Sometimes they'll wait too long. And those that embrace the technology, because you're not going to be replaced by the technology, you're replaced by somebody who knows the technology. So that's like the next big thing that we're going to do. So AI, 2 letters.
AI, and I like you demystifying it as it's a tool. And it really is, as you said, like using a calculator. Do you really want to be doing longhand division with a pencil? Which is what a lot of people do right now for their donor prospecting. They're digging through records, they're trying to make connections on their own manually, and it's an incredible amount of work that is unnecessary, unproductive, low value work at a time when we have tremendous constraints. So we've got to be able to work more effectively, and so it is just a tool to do that. But alongside that tool, it still requires discretion, it still requires relational fiber. And so, as you said, it's just a tool in someone's hands. So I'm really excited about the power and potential of AI. We're working on a project with you right now for one of our clients where we're taking a lot of data that's looking at not just medical records, but experience data and marketing data and other things, and bumping them all up against each other, and to be able to take millions of records and have something that is frankly smarter than we are say, oh, here's an association. This is who you need to be looking at. It is something that we would never have the manpower or frankly the intellect to do. So we then will get information and we will have to use it appropriately. However, I think having the tool is such an accelerator and frankly a cost saver that even investing in AI, it's another line item in your budget. It is a line item that is such a multiplier effect that you would be foolhardy not to include it.
And we do have, it looks like a couple questions, but we only have about 5 minutes, so maybe we can take these really quickly.
Okay.
We had one from Joanne who said, and I guess this is directed to both of you, will Grateful Patient Fundraising help us narrow the search for that 5% you mentioned?
Absolutely, absolutely. I was going to answer it first. Yes. So, here, I think you've always got to look at the value chain, and the reality of the value chain is A prospect who's had a patient experience is far more cultivated than anyone else who's going to walk in the door. However, we are also not indifferent to which patients we are trying to engage with. And so it goes back to what I was saying earlier about strategy. You need to know, what are the strategic plans of your organization? What are the strategic priorities? Because if you're focusing on, say, oncology, we need to engage the oncologists. We need to engage the people who are in that service line. We don't necessarily need the orthopod or the nephrologist, because they are not going to have the same level of runway to engage a patient that someone who is aligned with our current transformative priorities. So think first and foremost, strategy always. What are those service lines that you're going to need to advance? Who are those physicians, nurses, other providers who are associated with that service line? How do you then build deep? Because what a lot of folks are doing with Grateful Patient is, in my mind, foolhardy. They're building very shallow, very broad programs. And it is smarter, in my mind, to pick a place, go deep, rather than just kind of doing a whole lot with a lot of different people.
And
But
just crossing your fingers for bequests.
absolutely. And
Right.
people will say, oh, we've engaged all these physicians because they're donors. We've engaged these physicians because they're on their board. Well, that's interesting and that's nice. But do you really want to try and engage all these people across all these service lines who ultimately have no runway to be able to say, oh, Jay, you had an amazing patient experience. Let me tell you about something amazing we're doing. And so you got to marry the two up. But Grateful Patients, yes, pay attention to it all day. It is one of the best, most effective ways to identify aligned potential donors. The only exception, I would say, is if you were raising money for community health, community well-being, social drivers of health. There you've got community donors who want to step forward too. That's the only place where I think you need to really prospect outside your patient population, because that's going to open up a whole new constituency for you of people who care about investing in the social fabric of your community.
And the last one here actually is a two-parter, but I think either of you could answer this. But Bill should.
Betsy talks
Bill-
too much.
No,
Betsy
no,
doesn't
no,
talk.
no. This is from Gavin, who asked two things that are really interesting. One dovetails what you were just talking about, and the other one is more about the trust issue. So the first is, with a shrinking donor base, aren't we all going to be trying to engage the same donors? And is anyone trying to do anything large scale to address this trust issue?
So the trust issue isn't the only issue associated with building a broader
Right.
donor database. If I kind of get behind something that Betsy said, which is basically, well, I'm going to interpret the way I heard it, is that you don't have enough time and money to do everything in a sort of egalitarian way. What you have is you have a window of time where you're going to be expected to produce results. I mean, if you're in a well-run organization, and in that time frame, you have to be very pragmatic about what your opportunities are. I mean, something we do every day, right? And that means that you need to focus on as Betsy said, where you have a clinician who matches what it is that you are seeking investment for. That's, in my mind, that's a very obvious place to start. And then you pick the best of the folks that fit that model, and then you work your way down through that. It won't be the guarantee. It doesn't absolutely always work, because you'll find somebody over here whose brother's cousin came in and they were here for oncology and you were raising money for it. All you had to do was ask me. Statistically, that will happen, but what makes sense is to kind of tilt the playing field in your direction. If let's say it's oncology, if you can isolate the people that are providing the care, and then isolate the people that have been donors to that before, and then maybe you can get a couple of volunteers that are involved with that. And oh, by the way, you find folks that are philanthropic and wealthy. That just makes all the sense in the world, because that means you actually have a shot at getting it done in the time, the objective in the time frame that you have available, with the resources that you have available. Life's short.
Life's short, and unfortunately our time is short too, so I think we'll have
Did
to
you
end
just
it there, unfortunately.
You have to pay me for that.
That was my cue. Thank you very much. Betsy Chapin-Taylor, Accordant, Bill Tedesco, DonorSearch. Thanks to all of you. Please join us for Leah Kroll talking about innovation in nonprofits and her book. You can hear all about that tomorrow. That's at 1 p.m. Eastern tomorrow. And make sure, in the light of all the data we've talked about and the importance of asking people questions and actually listening, that you complete that survey. As soon as you check out today, we really do pay attention. What you say is what you will end up seeing and hearing in the year ahead when we approach season 10 of the Philanthropy Mastermind series. So until next time, take care of yourselves. We'll look forward to it. Thank you.
Thank you.
Thank you, Jack.